So welcome everyone to today's webinar, Deliberate Practice for Dynamic Emotion Focused Therapy. This is focusing on higher level skills, intermediate level skills in DEFT. My name is Tony Ruminaire with Sentio Counseling Center, and I am very pleased to be joined by two guest experts. There's Susan Warshaw, who is the founder of Dynamic Emotion Focused Therapy Institute, which offers ongoing training program and webinar series for psychotherapists. Susan authored A Therapist Handbook to Dissolve Shame and Defense, Master the Moment. And her forthcoming book, The Practice of Dynamic Emotion Focused Therapy, a Shame-Sensitive Workbook, will be released by Routledge. She is a certified IEDTA teacher and supervisor. Welcome, Susan. We are also joined by Bridget Quibideau, who is a licensed marriage and family therapist, a Feldenkrais practitioner, and the DEFT Institute training program coordinator. She has a private practice in West Los Angeles and has been working with people who suffer from chronic illnesses and unexplained pain, as well as presenting to groups on topics related to movement, mindfulness, and mental health since 1998. Welcome, Bridget. I am with the Sentio Counseling Center. We are an online low-fee sliding scale counseling center in California. We have openings currently for couples and teens starting at $30 a session. So please consider us for your very low-fee referrals. We also have a intensive deliberate practice supervision residency. And if you're interested in that, please see our website or email me and I can give you more information about that. And actually, why don't we go ahead and do this right now? Let's put Susan, Bridget, and I, let's all put our emails in the chat just so people know how to reach us if they want to. And great, we still have some more folks showing up as well. And just so everyone knows, today's webinar is being recorded and will be posted later on YouTube for everyone around the world to learn about DEFT. So please do not share any confidential client information or anything like that. There will be opportunities for you to do some experiential exercises of deliberate practice for DEFT. In fact, that's the main focus of today. And we're going to ask you to do the exercises in the chat, and the chat is not saved in the recording. So please know that as you're doing the exercises in the chat, that will end up being confidential. That will not be put on YouTube. Also, if you have any questions while we're doing the webinar at any point, even if I'm in the middle of yakking or whatever, please put your question in the chat and we will get to your question. So why don't we, you want to take it away, Susan?
Sure. I'm so delighted with this collaboration with Tony, who's done such absolutely amazing work with deliberate practice, and his work enlightens me and our program. We're incorporating more and more of this kind of practice, and I'm really delighted to participate in these webinars. So we're going to be looking at shame-sensitive defense work today. And paradoxically, people who come to us for help in relieving their suffering are often fiercely reliant on the very mechanisms that impede their growth and well-being, and can definitely and do present some of the major barriers to treatment. Usually they have little awareness of these mechanisms and therefore little choice over them. So we might link those two thoughts together. Little awareness, therefore little choice. And these, I call them self-protective strategies, can do, I'm sure you all know, enormous harm. And a young man comes to mind who I just saw this week, who has some really tremendous talents. He was also heavily conditioned to put his needs and feelings in the background, and he is compliant, very accommodating, very likable. He's, people are drawn to him. And at the same time, this accommodating, excessively accommodating defense, if you will, has, I think, held him back significantly in as far as his career potential. And also other dreams that he's had. He was involved with a woman for years. He treated him horribly. And at the same time, these self-protective mechanisms were traits that he thought really helped him. He saw where people liked his compliant nature. He got rewarded for it. He was attached to it. But there was a great opportunity in letting him become aware of how much these mechanisms were standing in his way. And something I wrote down a comment he made. I just saw him yesterday, in fact, and taped it. And he said, I was trained to negate myself. I feel like I have multiple selves and I don't always know what to trust and what to listen to. I have a desire for more integration and clarity about who I am and what I want. So, as I said, helping him to become aware of these mechanisms can be enormously useful to him. At the same time, we need to do it with shame sensitivity. So, what do I mean by that? Here are some, by no means all, of the principles of shame-sensitive defense work. Gaining permission to raise awareness of the defenses. I used to just barrel ahead and point things out, and sometimes alienated people. And now I want to be very careful to gain consent. I might say something like, would it be okay if we notice together anything that might be standing in the way of your access to your feelings or to our connection, given what you're hoping to accomplish in therapy? I think this could really help you, but you tell me, how does this sound to you? And I have to be in a place where it's okay if they don't choose to go this route. It's a true question. I encourage them to give me that kind of feedback also. Refer to the defenses as resourceful coping mechanisms. This fellow's compliance served him, and it's also done a lot of harm. But I want to acknowledge that these traits, have been resourceful, and I want to normalize them. I might say that, I can well understand why you would have gone this route. I probably would too, given the dynamics in your own family. So I want to give context to the defenses. They didn't just pop out of nowhere. They have served a purpose. We're trying to help them see where they can have more flexibility with them. However, he may still use them in certain instances, but we could help him have an option to not employ them also. We want to always explore defenses collaboratively. I'm always checking in. Is what I'm saying making sense for you? Tell me how you see this, or how it lands with you to hear what I'm saying. I want to do everything as a partnership. separate the person from the defense. Just helping him to recognize that he is not his compliance or his accommodating personality, that these are habits he's learned. As I said, they may help him in some situations, but he can also stand back and observe them. And at this stage of his life can exercise choices that he didn't have at one time. So we're helping to, helping the person to disidentify with their defenses. I want to empathize with the difficulty releasing defenses. This is not easy for anyone. It has sometimes felt that these defenses, allow us to survive. And we want to let people know that we really get it. This is not easy for anyone. And it commonly arouses anxiety. And it often arouses shame as well. And there's a level of exposure, stepping outside of our defenses, that can be quite threatening and daunting. So we want people to know we get it and we're with them in that. And we will provide guidance if they want it. Seek to transfer compassion for the suffering caused by the defenses. Often people just have breakthroughs of sadness as they become aware of how they have so automatically been, at the mercy of some of these habits. And they begin to see with our help, sometimes the devastation they've reaped, and people might start even sobbing. They begin to connect with a lot of pain connected to compassion for themselves. And really, it's often through this breakthrough of compassion that the will comes online to begin to go into new territory, to give themselves far more permission to connect with themselves and connect with others much more authentically. We want to always offer an alternative to the defenses. I might say, instead of complying, with me, it's certainly not going to be necessary to comply. We could, if you want, instead begin to pay more attention to the feelings that are coming up right now in relation to whatever the situation is. So,
do you want to proceed to the next slide?
Yeah, the next slide.
Great.
Yep. So today we're going to go to another level of practice with deaf therapy, which is to help our clients become more aware of their defenses. And we're going to be looking at the defenses of rapid speech, projection, and self-contempt, which often translates to contempt for others. I find all the time that, number one, shame and anxiety often accompany these defenses. And when we can begin to talk about them openly, we see these distressing states diminish. And we're also relating with a level of attunement that people tell me they've never had before. And it allows them to feel my compassion, that I really care about their internal states. So do you want to put up oh, here we go. So we're, the skill criteria for today, we want to raise awareness of the self-protective strategies with shame sensitivity, talk openly about shame and anxiety that might accompany these defenses, and communicate with attunement and compassion.
Great.
Yeah. Did you want to comment?
Yeah. So first of all, some folks just joined. Please feel free to ask questions in the chat at any point. And now we're going to jump into exercises. This is the principle of deliberate practice, is that we kind of learn the best by trying things and then getting feedback from Susan. So I believe Bridget is going to role play the client. These are client prompts that are constructed. So these are not, these are role plays. These are not real quotes from clients, because, you know, this is being recorded for YouTube later. And Bridget is going to role play the client. And then Susan, maybe you could demonstrate a sample response, and then we could do it again and let everyone try it for themselves. How does that sound?
Yeah, that sounds great. May I just briefly, we're going to be
Yes.
focusing on one of my clients here, a young woman who came to see me quite panicked after one of many, her latest relationship fell apart. And she was breathless, telling me story after story about her past relationships. She was talking over my words, didn't seem to register my empathy, or barely noticed I was in the room, frankly. So I needed to find a non-shaming way to raise her awareness of this dynamic so she could feel less alone with me and with others in her life. So we're going to see how I'm going to attempt to interrupt this pattern in a shame-sensitive manner.
Okay.
So,
you guys ready?
and
Yep.
we're looking at rapid speech and talking over and anxiety.
Okay.
Please, Bridget.
I have a lot to tell you. I mean, I've been dating for several years after my divorce, and something always just blows up eventually. I mean, I've concluded that there are actually no good men in Los Angeles, and a few of my friends actually feel that same way as well.
Barbara.
You know, these relationships, they always start out good. Like with Frank, you know, he was a decent guy in many ways. He was good to me, but there was just something going on with him, and I'm not even sure what it was. He just started to pull away, and it really killed me. And I mean, I thought things were going well, you know. I mean, it was like with Steven, the guy before him. And I think maybe these guys just have like commitment problems or something.
Barbara, would you mind if I interrupt for a moment? I feel so much compassion for your pain. And you're helping us a lot by telling me about your experiences. I also get the sense that you feel pressured and maybe a little short of breath. Would it be okay if we go slowly so we can give our attention to what's happening inside, in your body, as we're talking together? I really believe we're going to get to everything that is important for you. But I think this kind of caring attention to your internal experience is going to help you a great deal.
Great. So we want to do that again now, where Bridget, I'm going to ask you to play the client again.
Okay.
And here, Bridget, I'm putting some notes to you in the chat as well. And then we're going to ask everyone to try responding in the chat. So type your response into the chat, and then I will read it to Susan. Susan can give comments.
Okay. And Tony, did you say there's notes for me? You want me to read something?
Yeah.
Oh, okay. Okay.
And so let's see. Anyone have any questions? If so, put it in the chat. Otherwise, Bridget, if you can go ahead and let her rip.
Okay. I mean, I have a lot to tell you. I mean, I've been dating for several years after my divorce, and something just always blows up eventually. You know, I've concluded that there are actually no good men in Los Angeles, and a few of my friends feel the same way. Okay.
Great. So everyone take a shot at that. Okay, Susan, so we got our first few responses here. I'm going to read them. So first of all, Susan, we had a question actually. Was this the first session that we were role playing, or is it a later session?
This would be a first
A
session.
first session. Okay, great.
I want to say though that before that interaction, I had also gone over, how I work and sought permission
Right.
to work in this way.
Okay.
But
Great.
so it was
Okay.
the first exchange, but it was within the first session.
So here is a sample response. The sample response for the therapist is, that must be so difficult to go through.
Absolutely. That's our number one response is empathy. Then it's like, how do we make an inroad? Because this woman was making no room actually for me to interact with her. I think she could have gone on for a very long time with a lot. In fact, she told me she had a lot of stories. And so I needed to let her know from my perspective that, that it could really help her if we don't lose connection to other parts of her besides the actual story, but what's going on inside of her as she tells me her story. And that opened up, I mean, the session turned out to be very deep. I don't think it would have been without the interruption.
Right. So let me share this screen again 1 second. So if you look at the skill criteria here, you can see raise awareness of the self-protective strategies with shame sensitivity. Now, the empathy in that response, would you say that is good shame sensitivity, Susan?
Oh, yes.
Okay.
It's attunement.
Right. And compassion.
And compassion.
Right. So
part of creating safety. Shame.
Right. So that response was really good at that part of the skill, but what was missing was the raising awareness of the self-protection strategies. And Susan, something I've found when I am trying to use methods of therapy that raise awareness of self-protective mechanisms, it's also sometimes called defense mechanisms, that it's actually kind of challenging. I can veer between doing defense work or empathy, but it's hard to do both at the same time. And can you speak to that?
Boy, and that is the marriage. You mentioned the sweet spot, and that's the sweet spot.
Yeah.
The marriage of the two.
Okay.
Because I have lost people, Tony, raising of defenses without a sensitivity.
Yeah.
That's why I developed DEPT. It's one of the reasons.
Right.
So,
right.
But you get the hang of it. You just get the hang of including these other elements. So I'm asking permission, may I?
Right. Right.
And
right. So
I think it will benefit her. I'm not just randomly directing her.
Okay. So here's a second sample response. The therapist response is, patient, would it be all right if I interrupted you for a moment?
Yes, we do need to ask that question. I realized the things I was covering, there were several things there that, and it's linking them all together that is going to make it effective, potentially effective. May I interrupt you because, I'm noticing you seem to feel pressured. And I think I'm picking up some shortness of breath. And I wonder if we could give some attention to what's going on inside of you at the same time that I'm glad you're telling me about your experiences, but could we also like not leave other parts of you behind here? So it's linking them. May I interrupt you and letting them know why I'm suggesting it? And it's also raising awareness of anxiety, shortness of breath, rapid speech. They're indicators of shame and anxiety. And they're going to stand in the way of connection and deeper work.
So it sounds like that response was kind of like the first response where it got part of the skill criteria like absolutely right.
Right.
But part of the challenge, this is why it's maybe an intermediate skill rather than a beginner skill, is because you have multiple parts that you're trying to weave together. Is that right?
That is correct. That is correct. And it seems like in most interactions that I have, there are multiple parts. And so it really takes some, getting the hang of that.
Okay, so here, let me try another one for you here. Can we slow down for a minute here? I want to let you know that we will have lots of time to
can I interrupt?
Yes.
Okay. You're on the right track about slowing down. We want to also look at something when I say, can we slow down? People may be inclined to feel criticized. She's telling me I'm going too fast. She's correcting me. It's my teacher, my mother, So even though the idea is correct, so would it be okay if we go slowly? So I'm not saying, would you slow down kind of thing.
Right.
Or that person was saying it like that.
Right.
But would it be okay if we go slowly? I'm introducing that idea. And I immediately say, so we can give our attention to your body and what's going on inside as you talk, because I really think that's going to help with what you're hoping to achieve here. So does that make sense?
Yeah, so it's a very subtle difference. In fact, if you weren't looking for it, you could totally miss it. But it sounds like you're just being super sensitive to clients who might have a lot of shame, and anything that could be interpreted as like, judgment, like, oh, you're doing it wrong.
Well, I find a lot of people are sensitive to that in my work. Not only my work, but every relationship I have.
It's an elite club I am very proud to be a member of.
Please read the response again now. The rest of
yeah, okay. So can we slow down for a minute here? I want to let you know that we will have lots of time to explore your difficulties.
Yeah, I mean, I like that phrase in there. A lot of time to get to what you want to tell me. That's also just trying to stay right with where she is, because I did sense she really wanted to get a lot out, and I get that. And there's a helpful aspect. So yes, I want to encourage you guys also to try to interweave these different elements. And I realize there are a few. So we're suggesting slowing down. We're giving a bit of information about why we're suggesting it and how we think it could help them. And also there is the piece of raising awareness of anxiety. And for her, shame was huge. So bringing up the pressured speech, I sense you feel pressured. And she said to me, boy, you're right. I mean, that was really attuned picking up on her pressured speech, and her parents never paid any attention to all that stuff.
Here's another one. Would it be okay if I paused you for a moment? You are sharing.
Okay, may I?
Yeah, please.
I love this, you guys, you know. I do this with myself, watching my own tapes all the time. I'm constantly shifting the way I'm saying things. But this idea of collaboration, you know, looking at how do we break that down? What does that really mean? So everything we're doing is together as partners. So it could be something like I'd like to make a suggestion that we go slowly so that we can, and then I'm going to say, does that okay with you? Does that make sense for you? I don't want to convey that I am the expert who knows what you need. And so I am going to pause you. It's such a slight little thing of language, but something that I feel is really important. So it's that, you know, if we're going to pause, we pause. We pause together. If this makes sense for you. Okay. I think therapy, I did it all the time. I've supervised so many tapes, and you see all the time where we see, well, you're going to need to, and it's like, well, do this now. Well, tell me this, or sit back now, or we give directives. And I feel that can be inadvertently shaming, because we're up here and they're down here, and it all gets communicated rapidly in subtle ways, but our unconscious speaks to their unconscious, and we're going to be, you know, we can miss opportunities to strengthen selfhood.
Great. I know we talked about that in our last webinar, the importance of the word we.
We and permission.
Yeah.
Does it make sense?
Yeah.
My suggestion, but you tell me how it is for
Right.
you.
Right.
Equality. And I know none of us mean to imply otherwise.
Right.
But language is tricky.
Right. Here, let me finish this one. So, would it be okay if I pause you for a moment? You are sharing so much important information. I would like to share with you what I'm noticing. Is that okay?
I think that's great. Well, I mean, I like it. I definitely think we need to insert that there is strengths that we're also witnessing. We're not just pointing out something that may need attention, but also what's working well. And her willingness to go right into where her suffering lies is very good. It's an asset. I like highlighting the strengths. And what was the second part?
I would like to share with you what I'm noticing. Is that okay?
Okay. And the asking permission, I like very much. That's egalitarian, collaborative.
Great. I'm curious what you think of this next one. So here's another therapist response. I can hear how painful this is for you. Would it be okay if we took a moment to notice what it is like for you to experience this, and even what happens inside of you, maybe even right now as you're talking about this with me?
Yeah, I mean, the invitation to look internally together is excellent. Say it one more time.
Yeah, I'm gonna read it a little slower too. I think I was going kind of quickly. I can hear how painful this is for you.
That's great.
Would it be okay if we took a moment to notice
Good.
what it is like for you to experience this?
Now, okay. From my perspective, she's not experiencing experience. She is rapidly telling me stories. You know, she's describing what
Right,
happened. She's talking about the guys.
right.
You know, they have these commitment problems and aren't good men. And my friends think the same way. And this guy did this and that. And she's not connected in any way to herself or to me. And that's what I call an experience.
Mm.
Is an awareness, a reflection on what we are both together experiencing internally and together. And we are not in relationship at this point. Another, really, I've learned this from writing, editing my writing. You use the word it. To experience, what was it? To experience this? Is that what it was? To experience this? Was that the phrase?
Yeah, what is it like for you to experience this?
So sometimes we'll say it or this. That is vague. Maybe obvious to us, but it really isn't. What is this? What is experience? So if we want to stay very attuned and reflect exactly what's actually occurring in the moment, it might be, how is it? Would it be okay if we pay attention to how it is for you to share these experiences with me? That's what she's doing. She's sharing, she's telling me about her experiences. But like I say, I don't call that a real experience of her feelings. And again, what is the this that she's sharing? She's telling us a lot of things. So we might say to let me in, to share with me all of these obviously very painful. She is talking about experiences with various men in your life. That's specific. This recent breakup with Frank, how is it? Well, I want to get very specific. It makes it more alive. There's more attunement. If that
Great. Let me try just one more response. Let's move ahead. People are really digging into this, and this is great because we really get to explore the nuances of this skill, by kind of looking at this. So, okay, here's the next one. I'm going to read this a little slower. May I say something? ? It sounds that it's a very big problem for
and
you.
You need to wait, and then you need to wait too, just so we all are aware of that. Sometimes we just assume. May I say something? Oh, blah, 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 blah. If we're going to ask a question, let's wait for the answer.
You mean if I ask the client a question, I actually have to mean it?
I actually have to hear their answer.
Therapy moves a lot quicker if I can just presume their answer.
And we do it all the time. I interrupt them. Well, it's been my blah, blah, blah. And then we're doing the same thing.
Okay. All right. So we have to mean it.
We have to mean it. And be prepared. Maybe they don't want to hear what you have to say. That's got to be okay with it.
Well, that's the problem with actually meaning it, is I've had clients say, no, you can't interrupt me.
And you know what? If they say that to me in a certain way, I say, absolutely. Tell me what you need to tell me.
Right.
I want to let them know that they can impact me. I don't have all the answers. They tell me that's what they need to do. I'm glad you tell me. And then when they're finished, and may I add a couple of, provisions to this too.
Right.
That I want to consider.
So you're willing to be vulnerable, for lack of a better word, as the therapist and not really control the session.
I'm willing to be relieved of the burden of knowing it all and doing this on my own. You know, I rely on my clients too, you know.
Okay.
We're partners. It's really a relief. And
Okay.
it's a relief to not have to have it work with everyone, and it's a relief to not have to get a certain
Yeah.
response
Okay.
or outcome.
Okay. So there's an interesting dialectic here, Susan, that I want to point out, which is you're presenting like a very skilled and nuanced approach to therapy, where every word matters and every intonation matters and the intention behind the words matter. But at the same time, almost paradoxically, you seem very comfortable with not always being the expert and not always being right, and kind of this kind of beginner's mind, I think it's called in meditation. Can you speak to how you achieve like both? Like, I could see achieving one or the other, but achieving both sounds really hard.
Do you mind if I compliment you, Tony, for being a great moderator?
Sure.
I really love
Sure.
the issues you raise. So, John Frederickson has talked very brilliantly about ideals, and that it's great to reach for ideals, but to also be mindful that we don't achieve them. I don't know that I have ever seen anything I've ever done where I don't see something I could do a little better. And it is an unfolding process. I think it is maybe more important than anything that we as therapists be kind and compassionate to ourselves and allow ourselves to just be where we are at wherever our awareness is. And so much wisdom often bubbles up in the process of just observing interactions and being curious, like you say, having a beginner's mind. We are constantly being taught by that process. So I no longer expect that, that I have some final product ever. So I'm just going to engage in the moment to the best of my ability.
To the best of your ability. This also speaks to, one of the more common concerns I hear about deliberate practice is, it's just going to turn trainees into therapy robots where they just do the same thing. And what you're describing is actually the exact opposite, which is where you can rehearse and aim for a high level of skill, but you're also aiming for a very high level of improvisation and openness to the moment.
I'll let it all go. I let it all go, and I know what I know, and I don't know what I don't know. And if I have practiced, I mean, certainly we're, through this wonderful opportunity to look at some of these details, these moments together that we would typically never notice, like the choice of the word of one phrase versus another. So this stuff is going to come in to our consciousness as whatever way it does. And when we're sitting there, we may find it just something pops up from this preparation we've done. But we need to relax.
Right.
We need to be spacious within ourselves and try that for our clients. And definitely be attuning to an individual, unique person and every response. Somebody said to me once that, boy, you sure repeat yourself a lot. And I was, because I've been taught to keep asking, well, how do you feel about this? And this person said, do you know how many times you've asked me that? It's a little embarrassing. So it's that kind of input from my client.
Sure.
taught me.
So, and being willing to receive that input, like being willing to be humbled. Emily has a comment here. Emily said, "I feel that improvisation is also attunement." Would you agree with that?
Absolutely. You know, we want to model authenticity and spontaneity. You know, we want to give our clients an experience of our to the best of our ability of what a spontaneous and more authentic and transparent relationship actually looks like. And that involves our vulnerability. Yeah.
So, and so that's come up multiple times today, is a vulnerability. However, you kind of reframe vulnerability as kind of releasing this, toxic responsibility of being a perpetual expert, right?
I don't know about the rest of you, but I have suffered from that and not enjoyed sessions.
Yeah.
And missed a lot. And I hate to say this, but I mean, I know I've hurt people.
Yeah, sure.
With my own agendas.
Right.
The pressure I felt.
Yeah.
To see something in particular happen.
Yeah. Yeah, the sessions that I look back on and I really cringe are the sessions where I had some agenda and I wanted to like prove something to myself or a supervisor or whatever. And like,
Exactly.
and it's almost like I was dragging the client along, and it, I really regret those sessions. And,
I do too.
and,
They know it. The client
yeah.
knows when they're being dragged along on some level.
Yeah. Yeah. So there's a kind of there's almost like a therapy, a professional humility or humbleness that we can cultivate that at the same time as skillfulness.
We can reach high. I love that, reaching high. Feels good to stretch. And we're going to be going into the unknown when we do that ourselves. We're going to be awkward. We're, gaining more skill involves stumbling, probably a lot, but it needs to be okay. And giving ourselves that breath, the breath to do that.
Great. Great. So we're actually running out of time here. It's interesting today. We went a bit beyond this skill and talked more about the meta kind of stance of the therapist, or the learning how to learn to be a therapist. So I think that's actually quite valuable. Maybe just in the last few minutes, Susan, you could talk a bit about DEFT training. If someone wanted to pursue more DEFT training, how they would go about doing that.
Sure, and I'd like to ask Bridget to jump in too. But we have been we experimented, starting DEFT with a format that I really had not heard of, and I've worried about it, but it's worked out. And it's been going on now 11 years formally, the training. I was teaching before that. But people can come in at any time. We have 3 levels of certification, and people join for 10 blocks. 10 sessions is a block, level 1, 2, 3. And I bring in a lot of tape material, a lot of different kinds of patients. And so we have an immersion every time we meet in different skills, different kinds of patients. And people in the training are at different levels, but we've been very lucky that we have a lot of very perceptive, sensitive people who seem to come in, and I've not felt like we need to be in the same place to learn together. Bridget, do you go ahead and
Yeah, I was going to say, much like Susan's talking about how her work and our work is, she's learned a lot by working with people and changed the way that she works by working with people. Our training program changes based on how the therapists in the training are responding and what they want. And so recently, just this last time, we started playing with doing half of the video analysis part super interactive with having people practice, and we got through 1 minute of tape in like an hour of class, and then for the rest of the video analysis went more quickly so that they could see more of the, you know, the whole session. But things like that we shift based on how people are responding to it. They loved that, and they loved having that variety, and so we'll continue that, and we'll shift that if we need to shift that at any point based on how people are responding to it.
talk about what you're offering too?
And so what we're also going to offer, so the training,
Please, if that's okay with you.
please, yeah. Why, yes, Susan, it is. So in addition to having that time where we're being more interactive with the video analysis during the training, I'm going to hang out for an extra hour at the end of the training that's optional for people, but where we can take the client material and do some role plays based on the material that they've already seen. They've already seen Susan work with this client, and then we'll just put it into practice for anybody who wants to really get in there and play with it.
Great. Great. So it's a highly experiential training is what I'm hearing.
Yeah.
Yeah, we're drawing attention to what the trainees are also feeling themselves, and what it's like for me to be, what goes on inside of me too. And I encourage sharing our vulnerabilities, and how we are, myself included, will be in moments, what the heck am I going to say now? I don't have ready answers all the time, and some responses are more difficult. Sometimes they're very difficult for me to make, frankly.
Mm-hmm.
So we want to notice that and support each other. You know, we're a very supportive community, I think.
I agree, and people comment on that a lot, how safe they feel being vulnerable in the training. And just to repeat something I said in our last webinar last week, I myself have this experience, but I think it's something we also hear a lot. People comment on how much they've changed as a person, not only as a therapist, but people are constantly saying, I take more risks, I have less shame, I have less anxiety from being in the program. And I know that's true for me.
And thanks for that, Bridget. And let me add that we have packages of webinars now that have been sponsored by different groups. And people can have access to actually quite a few actual therapy sessions, recorded sessions, a whole range of, you know, showing the sweep of the work with several different people, and can practice with that. Some of this tape material will have a time limited availability. So I do encourage people to look into some of these sessions and sit with them yourself, stop the tape. You can do this deliberate practice with my actual sessions, by just stopping the tape, client responds, see what you would say, see what I say, then stop the tape, go back, try saying it. Notice what it's like inside of you to say it. And when you hear yourself saying that, I don't see myself doing this, or I don't think I can do this, please be suspect of those thoughts in your mind, because I had them so many times and they weren't true. You know, isn't it true, Tony? You know, we'll think we cannot do something.
Yeah.
This isn't me. That sounds good. But the other part is you can take parts of it. You don't have to have all of the approach. You can take parts of it to good use. put it to good use, you know? Sometimes people are, well, if I can't do all of it, then I'm not doing it. That's not
Right.
true. Every
Right.
part can be helpful to
Great. Great.
Yeah, thank you, Tony, for
Great.
question.
Yeah, we're actually just about at the top of the hour, so we should wrap up. And how about, can you both please put your email again in the chat, just so if anyone wants to contact you, and I'm going to put mine in as well. And I know we hope to do more webinar collaborations in the future, so we will let everyone know who signed up for this webinar what the others are in the future. And yeah, I want to say thank you again to Susan and Bridget for joining us today. And thank you for all our participants, and particularly those who wrote in the responses. I mean, we got a bunch of very rich responses. This has been a great group, just like last time.
It's a great group. It's wonderful.
It's been a lot of fun. So, so thanks everyone, and have a great weekend.